Hello, beautiful people. Welcome to this week's episode of the Montpelier Happy Hour here on WVEW LP Brattleboro. I am your host and producer of the show, Olga Peters, and this is where we talk about how everything in Montpelier shakes out for the rest of us. I want to welcome to the show Leslie Goldman, who is a representative for Windham 3, which includes the towns of Rockingham, Westminster, and Brookline. And she also serves on the House Committee on Healthcare. So we will be talking a little bit about healthcare in the second half of the show. Hey, Leslie, so glad to see you.
It's a real pleasure, Olga.
Well, thank you for joining in on this many-week conversation of summing up the session 2025 from the Windham County perspective. So I will start with the question I've been asking all your fellow lawmakers. How did the 2025 session shape up for you, and how does it compare to previous sessions?
Yeah, it's a great question. I, of course, came into legislature in 2021. That was COVID.
Mm-hmm.
So my first year, I sat in this exact spot, looking out this window at the bee balm and the hummingbirds at this, when it was the right time of year.
Mm-hmm.
And it was, since I knew nothing, that was all I knew. It was very hard because it was hard to develop relationships and talk to people.
Mm-hmm.
What was interesting is at that time, Representative Bill Lippard was chair of healthcare. But because we were all sitting on Zoom, I had no idea how tall he was. So there were a lot of details about people that we just never knew because we were sitting on Zoom the entire time. So
yeah, no one had legs.
No one had legs. No one had anything. So that was kind of interesting. And of course, the first 2 years, the first session that I served was pretty much COVID all the time, trying to, create the environment where people could survive COVID. And, of course, Vermont did very well and was very proud to be part of that effort. The second year, we were in the State House. That was a hard year because I didn't have a place to live. So it was Airbnb. So I was packing in and packing out every week. And that was very demanding. There was no one allowed in the State House except for staff and legislators.
Mm-hmm.
And it was really quiet, but I didn't know it was really quiet. I thought it was the norm. Then getting into my second term, it went back to its usual self, which was chaos. And I found the subsequent terms, I didn't like the chaos. I liked the quiet and being able to be thoughtful and form relationships for people who you're working with. So we had very little contact with lobbyists or advocates that they're being called now. And of course, part of, I think, a weakness of our legislature is that we have no staff.
Mm-hmm.
So I consider it unfortunate that we get a lot of information from the advocates, and that can be very skewed and biased, and I think problematic. Mm-hmm. So that's one of the concerns I have with the structure of how the Vermont legislature is. This third year was even more chaos because we were dealing with three enormous systemic problems. You've heard: housing, healthcare, education, and to try and really redesign a system is enormous and takes a lot of time. The problem also is that we cannot obligate a future legislature to anything. Mm-hmm. So we only operate in 2-year increments. 2 years is not enough to redo anything on the level that we're talking about, healthcare, housing. Right. I mean, to create housing, that takes very long. To redo a system like education, enormous. Mm-hmm. So it's a real challenge. The design of the system that we have, I think. Yeah.
Mm-hmm. So, I have to admit, Leslie, I have often heard lawmakers say we're not allowed to obligate future legislatures to anything. And I always nod and I'm like, uh-huh. And then it just kind of dawns on me that I don't fully understand what that means because we put laws into place that last decades. So I guess I don't understand what the obligation is.
Well, it's more like a financial obligation. I mean, think about the what we have to do with our the Ways and Means has to set the education tax rate. It has to happen every year.
Mm-hmm.
You can't do it for 5 years because you're obligating future legislatures.
Mm-hmm.
So you can only obligate a legislature for the time that it is left in that particular legislature's time left. Does that make sense?
Yeah. And I wonder, do you have any thoughts on why we do it that way? And it's okay if you don't know the answer because I'm sure it's long standing.
I'm sure that it's custom, like you say. On the other hand, look at the difference between the previous term, which was a supermajority, and this term, which was not. So our supermajority could go wild and pass bills that obligate funds for the next 10 years, which then the subsequent legislatures have no control over, which means the voters have no access to.
Okay, good point. Good point.
Yeah, because that's kind of the point, is that we want the voters, our constituents, to be in control of who's making those decisions. So if they, I could get voted out. We noticed, we saw a lot of people not win their elections. Many of us were disappointed about that. But the voters would not have wanted to be held, to be forced to take on things that they didn't agree with. Mm-hmm. And they wouldn't allow to be, vote for a candidate of their choice.
Okay. Interesting.
Yeah.
Thank you. Yeah,
like a philosophical commitment to finance or whatever it might be. Mm-hmm. Mm-hmm. Or, even termination of pregnancy. Whatever. I don't really know what would. So, yeah, I probably shouldn't have brought that up. Never mind.
Well, you never know, I think is the point you're making. You'll never know what the next round of lawmakers have as priorities. Right.
That's right.
But you also bring in the very good point of some of these big systemic problems need longer term phased in approaches that go beyond 2 years often.
Always, yeah. Which means that it's only phased in 2-year increments. Mm-hmm. Which can mean to me what I call a lot of lurching, because this particular set of 2 years was a particular set of lawmakers. The next set of 2 years is an entirely different set of lawmakers, which may have different priorities and goals.
Mm-hmm. Mm-hmm. So we're getting in a little bit to systems a little sooner than I thought we would in the conversation, but because I know you have a background in healthcare, and you have experience as a family nurse practitioner for primary care, as well as a background and graduate work in systems thinking. Mm-hmm. So I'm kind of getting a little nerdy and excited here. But, given that constraint of 2 years, when you put on like your system thinking hat, where do you see other avenues we could take or other ways we could be designing legislation to maybe balance out those two ends of the poles, the 2-year requirement or the no obligation requirement versus the needing long-term system change?
I had a professor in grad school who said every system is perfectly designed to get the results it gets. So when we look at our broken systems, it's because the infrastructure in those systems are getting these broken results. It can be pretty challenging. I think that we need to understand that when we do laws, it's like policy, right? It's the 36,000-foot view of what we as lawmakers want to see happen. But the next part of the process is rulemaking. And the rulemaking process is what really creates the sort of on the ground implementation of the intention of the law. And rules can change when they get, they can be challenged or they can be found not to be helpful. but that won't be affected by the law as long as it doesn't, sort of go against the law.
Mm-hmm.
So that's sort of a way that can happen. Yeah.
Okay.
Rulemaking is more crucial than we know about.
Interesting. Okay.
And rulemaking is actually done more by the advocates and the exec, because the state, the legislature writes the laws, the executive branch executes the laws, and that's where rulemaking comes in. So this sort of tension between the legislature that we knew last session and the executive branch was obvious in that, kind of, yeah.
Especially in the rulemaking, it sounds like, of different
Well,
policies.
it could be, it takes years, the policies get passed. The rules can take a long time. And then it goes by a legislative committee to be sure the rules are okay, which also can take a really long time. So this whole process is enormously long.
Interesting.
Yeah.
Well, I suddenly have new respect for rulemaking.
Oh, yeah. The rules are crucial. It's sort of like at the not elementary, at the school board level, and I was on the school board for some time, we have the policy, which the school board, which is equivalent to the legislature, and then there's the procedures, and that's the same. How do you implement the policy?
Yeah.
And that's the same idea.
And I'm wondering, there's real wisdom in having the people who need to execute also be involved in the rulemaking, because they're also being impacted. But I wonder, I can also see how if the folks who are making the rules maybe don't agree with the policy, or maybe it requires change that they don't want to make. And I'm not laying this on anybody. I'm just using it as a hypothetical. I could see how maybe the rules might not be developed in as effective a way as perhaps might have been the intention. Are there ways, like in this system, the legislature and those making the rules can have any conversations to make sure they're on the same page? Or
not from my experience. The only place that I see that happen is there's this committee called LCAR, legislative something rules. You'll see it on the website, and that's what I just mentioned, where the rules have to be approved by them in order to be implemented.
Okay, thank you.
Yeah.
It's just my brain is spinning in many different directions.
It's very complex, and it's very what's the right word? It's not like, I don't want it to say that it's hidden, but because it's, what's our budget? $8.5 billion in the state of Vermont, something around there. That's a lot of money. It's a lot of implementation of that money. How it works in the northern part of the state might be different than the southern part of the state. All those variations need to be taken into account when implementing, some kind of legislation. Education is a perfect example. What's good in Chittenden County is going to be very different than what might be good in Windham County. So, in a way, well, we could talk about education. The work of the education bill, I don't have the number off the top. 494 is it? It's like the group that's looking at the mapping. That's a really good example of legislation that was very specific. You have to do 3 maps. You have to do it by December. So it was very tight. And so it was in the realm of this legislature. Now, if let's say what happens that there's no maps that are approved of in the second half of the biennium, which could happen if everyone says this stinks, then have to start from scratch in the next biennium.
And if we have a whole different legislature.
Exactly.
Yeah, fascinating.
Yeah.
Putting your grad school hat on, I really liked what you said, what you paraphrased from your teacher, that, broken results, systems get the results that they are designed to get. I guess it makes me wonder, and I take it from my view, especially on government systems, is quite often when we design a system, we assume it works. And if someone from outside that system is struggling to navigate it, we assume it must be their problem, not the system's problem. And so I'm putting those two thoughts together, and that just seems so huge. And like, how do you even start to pick that apart so that you can design systems with better outcomes? Because we need those right now, especially around education, healthcare, and housing.
Yeah, I agree with you that we tend to blame the people. But I think that the data really shows that 80% of failure is the system failure, not a human failure. So we just think, oh, we're going to replace the next commissioner and all going to be well. And we've seen a lot of churn, right, in our state government because I think people are being blamed for failure. And I think that's too bad. I think one of the Democratic caucus, which I'm part of, has 5 priorities, one of which is government accountability, which is a commitment to oversight and accountability that supports data-driven solutions and affordability. So that's sort of the idea. And we are working on this for this biennium as part of our caucus priorities. We have 4 others, which I'm happy to share if you're interested at some point.
Sounds good. Thank you.
Yeah.
Yeah, so I guess, but my question is, and I don't know if there's an answer, like how do we start designing a system for better outcomes?
But you can't start. We can't start, right? Because we already have systems. So they have to be layered on, right? And or what do you take away and what do you it's just really hard and requires, well, my frustration, of course, requires long term, a amount of time that is reasonable to get the work done. So yeah, I wish we could start from scratch. I'm not even sure I would want a citizen legislature, but that's a conversation for another time. Or I could, yeah.
Yeah. No, I would love to hear your thoughts on citizen legislature because you are not the first lawmaker on this show to say we don't have staff. This system may not be working to get Vermonters the laws they need to have, the policy they need to have. I'm hoping, I haven't done it yet, but I'm hoping to reach out to some folks who maybe know a little bit more about the history of our citizen legislature and to have a different conversation. But that aside, I'd love to hear your thoughts on maybe what's not working and how we could make it work better.
A couple things, I think. I imagine that this sort of model got started during farming season, and that's what drove it, which of course makes sense. And of course we're a rural state, and of course we're too small to we as Vermont are expected to do everything New York is doing, and that is not tenable if we want to be affordable. So that's part of the problem, is that we're just too small. We had a bill, it wasn't this session, it was the session before, that was trying to address making the legislature more accessible to a more diverse group of people. And, I can only say, being from Windham County, that the experience of being in Montpelier is incredibly disruptive to one's life. You leave, I have to leave Tuesday morning, I come back Friday night, and I'm gone, and that from the home, and that's hard. And people can adapt, but it's still stressful. That I don't know how to change that, but I truly envy people who are within commuting distance. If I live 45 minutes away, I would probably commute, but I live an hour and a half away, and spending 3 hours in the car is not practical. People in Brattleboro are 2 hours away. They're going to be, there's no consideration for that in the legislative, sort of milieu. So that bill that came forward didn't address that, but what it did address was making access to healthcare, and that kind of thing, so that we could have people serve who needed health care and are part of a family. And, so right now, most of the people who are serving are retired older people and or people who have, families who can support them through it, get them health care or have a salary or, whatever it is. But if you looked at the average age, it's very old. And with the latest turnover, it's even older, maler, whiter. Yeah.
Okay. Interesting.
And more conservative, obviously. Yeah.
Yeah. Yeah. Yeah. When you talk about commuting to Montpelier, I'll just share a little story because I think for me it always sums up how, bless their hearts, Montpelier and Chittenden sometimes forget about the rest of the state, and for good reasons. I can see how there's a lot of concentration in that corridor. I was a Vista volunteer in my younger days, and cool. During that time, I think we had quarterly get-togethers and trainings that we would all go to. And there were 3 of us, 2 from Windham, 1 from Windsor County. And we were always like through snow and sleet and hail and floods trying to drive up to Chittenden County where all the meetings happened, or sometimes they happened in Montpelier. And so we kept saying, do you think you could do something closer? Yeah. Just, if anything, so people can see other parts of the state, sort of thing. And we kept advocating for that. And finally they said, you know what? We know we've been meeting mostly in the Burlington area. The leadership said this. So we've decided to come south for you guys. And we said, oh, thank you. And we're thinking south is probably going to be like, not that far south, but not Burlington. And they came to Waterbury.
Yeah. Oh, exactly. Exactly.
We're like, wow, that's so. Yeah. But for me, it always summarizes that idea of the bubbles we can get into, and especially our geographic bubbles that we can get into.
Yeah, I mean, the disparity between southern Vermont and northern Vermont is real. I mean, the population center is obviously in Chittenden County, but that's also true Windham County, right? Because I live in northern Windham County, the whole thing is very different than southern Windham County. Yes. And Brattleboro. Totally different. So
yeah. I'm in the Deerfield Valley, and even though we're still southern Windham, it's not the same as the Brattleboro corridor.
Mm-mm.
Yeah. So true. Yeah. The hub town,
so
our true. Blessed hub town.
Yeah, well, we're lucky we have it. I mean, I feel that way about Bellows Falls, which of course is in my district. I want Bellows Falls to be vibrant because it's good for all of us.
Yes.
We need Chittenden County to be vibrant because it's good for all of us. It's the same thing. But as I say, it's very small. It's a very small state that's trying to reproduce all the same things.
I think that's a very, very good point. Yeah, and we do. We don't have the population to support a lot of what we need.
No, I don't think we do.
Mm-hmm. This has been such a great conversation, Leslie. We have just about 5 minutes left before we have to hear from some underwriters. So okay. I'm curious, given that you went through the upheaval of COVID as a new lawmaker, and now you've gone through this latest session, which was odd in its own ways. I'm wondering, what are you left sitting with now that this session is over? About do you have any major takeaways or things that you're like, oh, I hope next session, blah, like?
Well, I hope next session is easier. I feel like we spent so much time trying to put our fingers in the dikes, and it just was exhausting. I don't. The education bill and how that unfolded was really difficult in the conflict between the House and the Senate. I think, working with the Senate, I'm a House member, I'm allowed to be biased, is awful. And yeah, the Senate, just the way that they seem to operate is really different. I am very appreciative, though, I will say, this is back on education, who was appointed to the redistricting committee because I think that they were some really excellent people. Representative Holcomb, she's amazing. Representative Granning, also. So I have confidence in them in bringing to the table what's needed. I don't disagree, or I agree that we need to have redesigns our systems because, but I thought that there was this conflict that was very bizarre, which was we want our education system to be redesigned, but we don't want to pay any more taxes. So you can't not pay for things if you want to improve them. And I didn't know how to reconcile that.
Thank you for naming that. Unfortunately, I feel sometimes in Vermont in general, and I'm talking right down to the community level, we want to do better, but we're not willing to look at what that means for resources. Whether that means more time, whether it means more money, or something like that, where I don't know, maybe it's just because we've worked with scarce resources for so long, we're like, don't want to, it's like that, we're playing a game of dominoes and we're worried about shaking something loose. But it does, I think, leave us in a conundrum often when we're trying to move forward.
Yeah, and what's really interesting, and this is just a small example, but I think it's a good one, is there was a reappraisal bill. And I don't know if you've come across that, but the problem was that there are many towns that can't afford listers or can't afford to keep up with reappraisals or whatever. So they hadn't been, reappraised in many years. And well, in Rockingham, we happen to have a set of excellent listers. And we also just got reappraised this past year. But they were so angry about the bill. It wasn't like they couldn't see beyond their own Rockingham experience. Yes, you're a good lister. Yes, you had a lister there before you who was really superb and got all the systems really up to where they needed to be. And they were just angry all the time. So I kept getting angry, emails about this terrible reappraisal bill, not thinking that Baltimore can't afford any of this stuff. And they haven't been, so it's just this, it's too small. I'm also I'm not as interested in local control as many people are, because I think local control can be too local, or I worry about that.
That's a good point. Yep.
Yeah. I mean, when I was on the school board, I think we had 27 school board members for 1,800 kids. It was silly to me, but, there I was in the room. Yeah. So that's another thing about Vermont. We want local control. We don't want to pay for it. And we want standards to be the same all over. And what about the kids who aren't getting exposed to the kinds of things perhaps here that they might get, in the northern part of the state? So that's not fair to the kids.
Mm-hmm. Yeah. Unfortunately, we're out of time, but I, like I said, I'm glad you named it, because I think it's a conundrum a lot of us deal with, but we don't actually kind of see it a lot of the time. So thank you for naming it, Leslie. Representative Leslie Goldman and I will be right back after we hear from some underwriters here on WVEW LP Brattleboro. So stay tuned. Hey there, beautiful people. Welcome back to the second half of the Montpelier Happy Hour here on WVEW LP Brattleboro. If you're just joining us, I'm your host and producer of the show, Olga Peters, and I'm speaking with Representative Leslie Goldman, who represents Windham 3, the towns of Rockingham, Westminster, and Brookline. She also serves on the House Committee on Healthcare, so we'll be diving into that a little bit in this session. Before we do, I want to thank BCTV for taking the video version of the show, sharing it with stations around Vermont, as well as reminding people that the views and opinions of everyone on the Montpelier Happy Hour belong to those of the host and the guests, nobody else, not the platforms, not the radio stations. So send your angry emails to either the Montpelier Happy Hour at gmail.com or Leslie.
Not to me.
Not to me. Okay, just send them to me then.
Yeah. And Olga could send on what she wants.
I'll send on what's pertinent.
Yeah, exactly.
So thank you so much for being here, listeners. Thank you so much, Leslie, for being here. we want to talk a little bit about your committee work, but before we do that, I'm curious to hear about what might be happening around next session, looking ahead. And I think you mentioned during break talking about some ways to interact with the federal government, perhaps that might help Vermonters. Would love to hear a little bit more about that.
Yeah, Zahn Easties developed a group at the end of the session once we saw how things were declining. There was a very cute acronym, which I can't remember now. But he worked really hard, and I participated in some of those meetings. And, we became fearful about losing federal support for many things. For Medicaid, theoretically, they can't touch Medicare, but I guess theoretically they can touch anything. Mm-hmm. And, it was the idea of how can we prepare? So I think some of the focus on the session coming up is how to prepare for the federal impact. We had meetings with members of the staffers of the federal delegation. So we've been informed about that a lot. But I don't know where it stands now because the last information I ever heard was in May. And I don't know what's happened in the last 3 months, 4 months. Yeah.
So, well, things are changing and evolving all the time, especially at the federal level.
I couldn't decide if I was just being an ostrich, but I decided that I wasn't going to follow along because every time I got a new piece of information, I got upset, and then it was rescinded 5 minutes later. And I was just had to protect, my mental sanity. So, but we understand time has moved on and we're going to have to be very careful. I think there are immigration policies we know about. The SNAP debacle that our governor did was horrific. How do we not allow that? I don't know what our options are. I think that would become more likely through judiciary rather than healthcare. I'm not sure even where it would land, but there's a lot to think about in that realm. Yeah.
When you mention SNAP, are you talking about or referencing when Governor Scott sharing information? Okay.
Abhorrent. Mm-hmm. Yeah. Just sort of collapsing in the face of the Trump pressure.
Okay. Interesting. Yeah. Now, just because I would love to hear your thoughts as a lawmaker, Scott had said, totally paraphrasing here, this is a federal program, so why shouldn't they have the information? But it sounds like you feel very differently about that.
Yeah, it wasn't something that was done before. There's no precedent.
Okay.
And only now, when there's pressure from the federal government in this intrusive, heinous way, did he provide it. I just don't see why that was necessary. No. Okay. I think we need to protect Vermonters. Yeah.
Thank you.
From potential misuse. Mm-hmm. It's not like I'm feeling confident about the integrity of our federal government right now.
All right. So next session, it sounds like a lot of focus will be on the relationship between the state and the federal government.
More the impact.
Okay.
Yeah.
That the way things are moving so quickly in DC that that'll be an interesting conversation to have.
No kidding. Or scary. Interesting and scary. Yeah. It depends. Yeah.
So another thing I'd like to touch on, because it sounds like it may actually dovetail into these bigger conversations happening next session. You mentioned caucus priorities, and the first one being involved with government oversight. Would love to hear the rest of them.
Yeah. I'm a member of the Democratic caucus. We, of course, in Vermont don't have any party affiliation below the statewide level. So that's good. I mean, for school boards and whatever, but I'm happy. I feel like these are my people. We share values. So that's what's important to me about it. Mm-hmm. And as you mentioned, one of our first ones was government accountability. It's a commitment to oversight and accountability that supports data-driven solutions by the executive branch. A lot of times things get passed, bills get passed. We talked a little bit about rules, and they don't get implemented. They don't hire the people to do the job. So there's this thing called vacancy rates. And when we do our budget adjustments or our total budget, the executive branch says, well, we have all these vacancy rates, so we can use that money for something else. So they're not implementing sometimes laws that we have passed because they claim they can't hire people or whatever. Yeah. So we need to hold them accountable. There are many reports that are written that we ask for in the legislature and don't necessarily get read, don't necessarily get implemented. So there's a lot of data and information just sitting there that we don't address.
Mm-hmm.
So that's a huge priority. The other priorities I think are more straightforward. Ed funding, that's going to be a big topic of conversation for the next year. We talked about the redistricting committee and the work that they're going to do. They have to have their report done by December.
That's
so
right.
That's where that's going to start. Healthcare, there's this huge sort of crisis going on at UVM or UVM Health Network. Many articles are coming out about it. People really, I will say out there that I'm a strong supporter of the Green Mountain Care Board. Mm-hmm. I think we need the regulation in order to rein in healthcare costs. Mm-hmm. There have been many. There was one slide that was shown which really demonstrated how in hospital but outpatient medication treatment is the most expensive in the country by 3 times. I mean, it's absurd, and that's because of UVM Health Network. There's a problem between New York hospitals and how much Vermont money is going to New York hospitals. One of the bills we passed, which I'm very proud to have supported, was to have a monitor start looking at the UVM sort of process. And the letter came out yet today, maybe, from Mike Smith, who is the monitor, was saying they were not being honest. So that's a big deal. I hope we are addressing that.
Before you go on, I just want to clarify when you mentioned the amount of money going to New York hospitals. Yeah. Are you talking about the ones? There are a few hospitals that are actually part of the UVM network that are in New York. Yeah. Or is it Vermont residents who could go to a Vermont hospital? Oh, okay. So it's the ones that are in the network.
In the network.
Okay.
But there is, money that comes from Vermont ratepayers, Vermont population to go and support the hospitals in New York.
Okay. And it sounds like maybe it's out of proportion to what's coming from New York to support the hospitals.
I don't know how you would measure that, because I don't think there's any money coming from New York hospitals. There may be patients coming from, and we'll then bring their payment systems, but I don't think otherwise, no.
Okay. Thank you for that clarification.
Yeah.
Sorry, I interrupted you.
No, I'm actually looking for the name of that bill because that was an important bill. We spent a lot of time on it.
The monitor bill?
Yeah. Yeah. Once again, it was a Green Mountain Care Board bill. While
you're looking for it, did you find it?
No, not yet. Sorry.
Okay. I'll just share that last week I had your colleague, Chris Morrow, on.
Oh, yeah.
And he was talking, just briefly touched on healthcare. And he was sort of saying how much he noticed a lot of our energy went to education and attention went to education this session. But he's like, it really needs to go to healthcare. Unfortunately, with healthcare, as soon as you start touching on it, you're like in the weeds and people's eyes are glassing over. And so it can be a hard conversation to have, I think was the point he was making, just because it's such a interconnected.
And just look at it because it's interconnected with the federal budget too. So Medicare is federal, Medicaid is federal and state funded. So we can't touch Medicare. There's this, what's it called? Blocking on it, but it's self-insured. Like a big company or corporation might just self-insure their whole population. We have no access to any of that data. They may buy an administrative plan through Blue Cross Blue Shield, but they're not actually insured by Blue Cross Blue Shield. So they're actually self-insured. So they just put this pot of money in. So it's so broken, or it's so complex, that we can't get our heads around it. So when we talk about commercial insurance, which is Blue Cross Blue Shield, but we're worried about going bankrupt, it's about 70,000 people. It's not a lot of people. It's like, I think it's 20% of Vermont. So it's too fragmented. Mm-hmm. It's very fragmented.
Interesting.
Yeah.
Any going back to the caucus priorities, and if you don't find that bill, we can always still link to it in the show notes of the show.
Yeah,
so people can find it. Other caucus priorities you wanted to mention?
Yeah, so I mentioned ed funding, healthcare, government accountability, and then of course housing is our fourth priority. And the actual is a vision for housing infrastructure that ensures our state is meeting the needs of both current Vermonters and new Vermonters our communities and employers seek. Mm-hmm. And I think that's a beautiful statement. I support it wholeheartedly. It's long term. Mm-hmm. It's how do we get from here to there? We started this year with a housing bill that passed, and that was but that was quite a conflict with the Senate. It finally came out of conference committee, but it was brutal. Mm-hmm. But we did it. But once again, it's nothing fast.
Yeah.
Yeah.
Yep.
Yeah.
And are there any, along with these priorities, are there any policies that either have gone through or are being proposed that could align with those priorities?
Well, I think, the devil's in the details. So I think that a lot of what we did does align. Like in healthcare, there's this thing called certificate of need. And that was a process that people really found onerous and suffered through. So we changed that bill, and that was huge. The Green Mountain Care Board was responsible for certificate of need. So we changed all the thresholds. So it's not going to be anywhere near as difficult as it has been. So I think for healthcare, that's going to move faster. I don't know enough about housing to make a real statement about what we passed and how that's going to be implemented. But there's so many people involved that care a lot about it.
Yeah. Thank you.
Yeah. And there's one more I want to say. Yeah, let me just finish with climate resiliency, which I don't think we want to lose track of. So it's more about communities prepared to meet what the climate gives us. Mm-hmm. And that's a big deal. The Global Warming Solutions Act was trying to address some of that. I think we became more conscious of resiliency after the floods 2 years in a row, maybe even 3. And so that's important. There is a strong and powerful effort to repeal the Global Warming Solutions Act. So this election coming up and who gets elected is going to be a really important moment for our climate.
Mm-hmm. Yeah, just a little note for any viewers and listeners out there who are curious. If you go to what are they called? The Committee on Energy and Technology?
Yes, I think that's right. Yeah.
If you go to that House committee and look at the bills that went before it, you will see a number repeal that start out repeal this, repeal that, repeal this, repeal that. And I believe it was Laura Sibilia who said a few months ago when I had her on the show, she said that's mostly what her committee worked on, was making sure that the other bills weren't repealed, to kind of like stave off the tide of repeals that kept coming before that committee.
Yeah, the clean heat standard was another example of how things were manipulated to create a certain outcome for the election. That was really unfortunate with misinformation.
You're talking about some of the numbers that were put out around how much fuel would cost.
That's right. The increase in fuel costs. And so it was just really disheartening.
Mm-hmm. Thank you, Leslie. Anything else on caucus priorities?
I think those are the five that you're going to see, that we're going to keep thinking about. What we do as a caucus is we meet in December to revise. And so we'll see if these come through again or they get taken off or something added or deepened. So that's always a very powerful and good experience.
Well, and it gives you a way of focusing your energy, which is, crucial in such a compressed time frame.
Yeah, and of course, in our world, everything happens in committee. So all these things will then be, all the bills then get parsed out. All the bills that have been introduced at the beginning of the biennium are still have an opportunity for consideration, and then there'll be new ones that get introduced as well. So I didn't give you those numbers, did I?
Yeah, I was just about to say, during the break, you brought up some really interesting data about the number of bills that go forward versus pass. So yeah, if you would dive into that, I think listeners would like it.
Yeah, I think it's really interesting that the House introduced 521 bills that were introduced into the House. They then get distributed to the appropriate committee of jurisdiction. And then the leadership in that committee decides which bills are going to be taken up. And then what happens is, if it's called taken up, it's like a big bulletin board, the wall. So, you take it off the wall and leadership has to make that decision. The bills enacted out of low battery. How much time? I don't know how much more time we have.
We've got about 10 minutes.
Okay, I think I should last 10 minutes. That out of the 521 bills that were introduced in the House, the number enacted actually turned into law 73.
Wow.
Yeah. So there's a lot of very good bills that don't get taken up because there isn't time or it's not a leadership priority. So it's really the leadership in committees that make that decision.
Well, and I think what was interesting when you and I were talking during the break, bringing this back to that concept of the citizen legislature, 521 bills, all of them probably went through legal counsel to make sure that they were written appropriately and they didn't,
constitutional.
We're constitutional. So that's a lot of work to then
it's a lot
only
of
turn around 73.
Yeah. It's a lot of work. It feels like a lot of waste. A lot of them are personal agendas, and that's really distressing. Yeah, I find it. Well, the other thing about the citizen legislature we were talking about is that we don't have staff. So we get a lot of information from biased sources, advocates, and lobbyists. And I had a really great intern. So interns can be very helpful, but it's really hard to be able to go deep into everything. You just can't. There's too much. So yeah, it's a frustration.
Well, and I think it's one worth keeping an eye on, because as you were telling me, that ratio of like 521 to 73 is not unusual. It's not like just because this session was kind of tough.
No, I think it's pretty standard.
Okay.
In my years,
In your experience.
Yeah, I've been there 5 years. So, but my first years were a little odd.
I'm starting to wonder if that's just how sessions are going to be from here on out, just a little odd.
Yeah. Yes, a lot of people go to, sort of national conferences and they talk to a lot of people and they see how, it works in other places. Oh, you get a full-time staff and you make $80,000 a year. You can do the job in a meaningful way. It's harder for us. Yeah.
We have, just over 5 minutes. I'd love to touch quickly on your committee work. I believe there were a couple bills you wanted to mention. One passed is Act 21, which has to do with medical relief. And then I don't think the other one passed, which was H71, which had to do with some oversight in clinical decision making.
Yeah, I'll also add, in healthcare, we had 45 bills come into our committee and we passed out 15.
Okay.
So that's not a lot. I mean, out of, it's a lot of work. I think some of the bills that were really important, you mentioned those two, which I'll speak to, but I talked about giving the Green Mountain Care Board more authority over hospital budgeting, because our hospital system, once again, a system, is collapsing because, and our commercial insurance, Blue Cross Blue Shield, is facing insolvency because of failure in the system. And giving Green Mountain Care Board more authority to manage budgets, particularly at UVM Health Network level, is an attempt to rein things in. Okay. Yeah, and so those passed. That was really important. The medical debt bill, I think, is a really important consumer bill. This was introduced by our treasurer, Mike Pishak. Started in both the House and the Senate, which can happen, and you don't know which side is going to take up. In this case, it happened to be taken up by the Senate. And then, of course, it crosses over to us, and we do our same thing. But it's like the whole thing has to be redone in each chamber. So all the testimony and everything, witnesses and everything has to be reviewed. But the medical debt bill, bankruptcies right now are frequently because of medical debt. And medical debt is not a choice. You can choose to buy a car and make a stupid decision. You can't choose to get in a car wreck and require hundreds of thousands of dollars of medical care in order to recover. So the medical debt has been really breaking individuals and families. So Mike Pishak, Treasurer Pishak, introduced the bill on the model of Rhode Island. And what's happened is there is a nonprofit that is buying up the debt that hospitals, are holding. So there's a lot of free care and unpaid debt, and hopefully to get it off their books. So it helps the individual consumer, it helps the hospitals. It's a good thing. So that was a very exciting bill to have go through. So that was a good one. Very happy that passed. H71 is actually a long name for trying to control having private equity by our hospitals. Yeah. Now in Vermont already there is private equity that's owning nursing homes or long-term care facilities. And what happens, of course, with private equity is they come in and sometimes their intentions are not necessarily honorable. And they take the entity and strip it of everything and then sell it and move on. This happened in Massachusetts, a big crisis there. So this bill is trying to explore that possibility of having private equity come in and maybe buy some of our hospitals. You may recall that we had an Act 167 report that came out last session. That was Bruce Hammery's report. That was a crucial healthcare report. We heard a lot about it, and a lot of what we tried to do was implement the recommendations from that report. It was fairly well documented that 9 out of 13 of our hospitals are in the red, and can't really survive under current conditions. It's a system flaw, once again, right? You don't have 9 out of 13 hospitals in the red if the system is healthy. Right. So that just is clear. Some of the recommendations from the Act 167 report was that we have a freestanding birth center and have a licensure available for that. We passed that bill out of healthcare. And so now, since the pathway is available, someone who might want to open a freestanding birth center can do so. We've heard about Copley closing. That was a big deal. Closing their birth center. This is actually pretty interesting. The way that it was described in the report is, think about a cardiologist. If you live in a community that requires one cardiologist, well, you can't have one cardiologist because not one person can be on call 24/7, every week. So in order to have a lifestyle that a cardiologist might be willing to entertain in your community, you need 4 cardiologists. Community can't afford 4 cardiologists, nor is there work for 4 cardiologists. So the regionalization is really important. And so there's investigation into how to regionalize things. I'm a big proponent and believer in centers of excellence. This also came out of the report. You don't want to go to a place that does 3 hip replacements a year. You want to go to a place that does 300 hip replacements a year, so that if something goes awry, they can say, oh, wait, I saw that before. I know how to fix it.
Yeah, seen this, done this.
Yep. So, there's a lot of things that came out of the report was crucial. that are very slowly being implemented. I'm not sure what will happen. I haven't heard of anything yet. But the freestanding birth center is one, run by midwives. Hopefully, a group of midwives will want to do that. And hopefully, the reason I bring that up is because Copley couldn't staff 24/7 a birthing center. But off-site health doesn't have to be staffed 24/7, because when someone goes into labor, the midwife shows up.
Right.
It's not like they're there waiting for that crisis, whatever. So it's a different model. So
interesting.
That was a bill that came out of our healthcare committee this year.
Okay. And I have to congratulate you, Leslie. You ended like right on time.
Oh, perfect. There's so much more to say. It's just amazing that, yeah.
Well, you're welcome back anytime if there's something specific you'd like to talk about. Yeah. Before we head out, a couple things. Anything you'd like to leave listeners with as we, I feel like we're moving into the downtime of the session. Any reports you think people should keep an eye out for, committee meetings, things they might want to keep an ear to the ground on?
I think the redistricting in education is going to have a huge, huge impact on everything. So once that comes out, it can then start the continuing conversation about what our education system might look at. I think in healthcare, it's going to be hospital budgets. The Green Mountain Care Board now will have their hospital budget. I think they have to give their hospital budget recommendations by September 30th or something. So that's coming right up. That's going to be important. There was a bill that we passed that was really important about costs of outpatient medicines at hospitals that had to be, curtailed, as I had referred to earlier. So we saw an important reduction in cost to Blue Cross Blue Shield and the commercial Blue Cross Blue Shield because of that bill. That was a crucial bill that we passed. So there's just many different examples. Everything sounds small, but it adds up because it's a system. Yeah, it all has influence. Yeah.
Thank you. If people wanted to reach out to you, how can they do that?
I have a website. Just go Representative Leslie Goldman, and it'll come right up. Vermont. If you add Vermont, then it's a given.
Thank you. As always, the Montpelier Happy Hour is on WVEW LP Brattleboro every Friday at 2 and rebroadcasted on Wednesday mornings. You can also find us on YouTube and wherever you find your podcasts and on BCTV. So I hope everyone has a good weekend. Thank you for joining us. And Leslie, thank you for joining us.
Thank you, Olga. It's been a pleasure.